We all know that heart disease is the #1 killer in women, and we know how widespread breast cancer is. New research has now determined that the two possibly are linked. That should give many women the heads up. There's so much to celebrate when beating cancer, especially breast cancer, that's happening more and more these days. But especially with breast cancer survivors, there's something else to watch out for.
There are very few but significant forms of treatments for cancer that can end up causing some heart dysfunction, be them heart attacks or heart failure or cardiac arrhythmias, etc.
That's where a new area study comes in called oncocardiology. Dr. Guilherme Oliveira heads up University Hospital's such program, one of the very few in the country focused on cancer patients at risk for heart issues. They're monitored mostly through echocardiograms or ultrasounds of the heart. It's how doctors are finding out way too often that heart disease develops during or even years after successful cancer treatment. It would indicate indeed a link.
I can't really tell you what the percentage of patients undergoing cancer treatment really know of these risks. I don't think it's public knowledge. I don't think it's a household type of knowledge like a heart attack or stroke.
And while a lot of work needs to be done to get the word out, there's also round-the-clock research underway to figure out why this is happening. It's known, though, those most at risk are women, especially women who have undergone radiation or received the most common chemotherapy treatments for breast cancer, including Herceptin or any kind of anthracycline.
This was almost never talked about until about 2010. And then in 2010, from 2010 forward, it's an extremely rewarding field of research and clinical practice.
And that reward is expected only to get greater as the numbers of lives saved gets greater, perhaps from awareness alone. So when you go to the doctor's office, be prepared. Have a lot of questions, collect all your information. You are your best advocate. And don't forget to go red for heart health this month.